The most effective ways to help people at home is, once again, education. Because when a person's living at home, there are safety factors to consider. And things like driving, for example. One should not be driving once there is a, even in the early stages. We used to think it was safe to drive in the early stages of Alzheimer's disease and other dementias, but now we're finding the navigational ability is impaired, and understanding what's on a sign, the ability to read words is impaired, and that certainly can interfere with driving. So driving is one, adverse drug reactions is another. So we want to highly educate and be sure there's a system in place for that person taking their medication to prevent accidental underdose or overdose, because what happens then, it precipitates problems with all the other chronic illnesses, diabetes, they're dealing with blood thinners, and if someone's not giving their medicine or supervising their medicine, that could result in a problem. House calls would be wonderful if there were enough resources for primary care providers to come in and do that prevention. If someone's living alone, there's the risk of dehydration, malnutrition. Often adult children are living far away, and in that case, I recommend them getting a case manager, and there's a National Association of Case Managers that can come in and be sure, almost like a coordinator for the care. They can speak with a physician. They can help them find places for the next stage of their illness. For example, the progression from living alone to going to assisted living or living at home and getting increasing amounts of home care, because probably half of the people stay, or even more than half, stay at home to the end of their illness. So whatever direction they choose to go in, making sure home is safe, or assisted living, especially if the adult children are far away and not able to be directly supportive, is very important. So safety issues, getting the right care, not being afraid to hire someone, an agency to come into your house as long as they've been checked and bonded and all that. So many older people don't want anybody to come into their house, and that leads to the person being at risk. The other thing we need to prevent is caregiver burnout and stress, because often it falls on one person in the family, and that person ends up trying to do everything. And then often the caregivers get depression, and they're sicker than the person with Alzheimer's from a physical standpoint, because they're not going for their own health maintenance and their own health screening. So caregiver burnout is huge, and that's something we want to prevent when the patient is at home.